We need to be very careful, and our hospital infection control team be vigilant in terms of our own staff becoming positive. Our positivity rate has gone up.
मैडम करीबन 3 से 4 दिन हो गए और भाई के लिए बेड ढूंढने के लिए मुझे, और कहीं पर भी बेड नहीं मिला। एक स्थिति ये थी, मैं पल-पल अपने भाई को तड़पता हुआ, मरता हुआ देख रहा था।
Hello everyone, good evening. You're watching News Epicenter with me, Marya, Shakil. India has recorded over 2 lakh cases for 2 consecutive days as the surge continues to wreak havoc across the country, forcing administrations to impose lockdowns. We are facing the threat of mutant strains and poor COVID discipline, even as we are armed with vaccines. Young people seem to be the target of the second wave as the virus becomes deadlier by the day. But the spike in cases has revealed the crumbling health infrastructure, is exposing a shortage in beds, oxygen supply and basic medical care. Both frontline warriors and the Aam Aadmi facing the brunt of the crisis. There is a manpower crunch across the country as many doctors and supporting staff are testing positive for the virus, while the dismal state of medical facilities has caused people to die on the doorsteps of hospitals. Their bodies ferried in garbage vans, denied dignity even in death. This is the state of affairs over 1 year after the pandemic started, and we still seem to be unprepared to tackle this crisis. Not just the big hospitals of the country, the government hospitals and clinics in B towns of India, mandated by state governments to be prepared for the crisis, where the breakdown of the health system and the fatalities expose a grim situation. So let's decode the reality of the fight against COVID from the frontliners and the patients and the experts. Joining me on the show, K. Sujata Rao, former Health Secretary, Dr. Ashok Seth is Chairman Fortis Scott's Heart Institute, Kaustubh. His paternal uncle died due to lack of care and hygiene in a hospital in Dehradun, and then he was given a wrong body for cremation. Ayush Kumar Tiwari is Dhanbad based. His relative did not get admission at the right time. Dr. I.S. Thakur is Medical Superintendent of Patna Medical College Hospital. Dr. Rakesh Mishra is the Director of Center for Cellular and Molecular Biology in Hyderabad, which is a premier research organization. Dr. Thakur, who's joining me from Patna, coming to you first, it appears to be a very grim situation in Bihar. Why are states, including Bihar, not prepared? From the first wave to the second wave, weren't you really expected to ramp up your capacity?
एक्चुअली है कि पहले जो है सो मैक्सिमम पटना मेडिकल कॉलेज में 53 मरीज जिस दिन मैक्सिमम हुआ था 53 था. अभी एवरेज जो है सो 100 मरीज भरा रहता है, 100, 105, 90 से 105 के बीच में आता है. एवरेज एडमिशन इज अबाउट 18 to 25 डेली. जो 18 से 25 मरीज आते हैं उसमें कुछ सीरियस भी रहते हैं, कुछ प्राइवेट हॉस्पिटल से भी हमारे यहाँ आ जा रहे हैं सीरियस मरीज, जिसके कारण हम लोग को थोड़ा सा कैजुअल्टी माने थोड़ा ज़्यादा हो जाता है जब बाहर से आते हैं ऑक्सीजन के नाम पर, कि उनको ऑक्सीजन वहाँ प्राइवेट में नहीं मिलता है तो हमारे यहाँ आते हैं. हमारे यहाँ ऑक्सीजन की कोई दिक्कत नहीं है, हम लोग ले लेते हैं उनको.
डॉक्टर ठाकुर, कुछ दिन पहले हमने एक तस्वीर देखी थी, काफ़ी दिल दहलाने वाली थी. नालंदा मेडिकल कॉलेज हॉस्पिटल के बाहर कुछ तस्वीरें आई थी जहां पर लोग गए थे लेकिन बिना इलाज के उनकी मौत हो गई. पटना मेडिकल कॉलेज की स्थिति क्या है?
एक्चुअली नालंदा मेडिकल कॉलेज के बारे में तो सुप्रीडेंट नालंदा मेडिकल कॉलेज ही बता पाएंगे, लेकिन पटना मेडिकल कॉलेज में हमारे पास 112 बेड है, 112. आउट ऑफ 112 जनरल के लिए 87 है और आईसीयू के लिए 25 है. एंड 30 बेड्स जो हम लोगों ने रिजर्व रख दिया है फॉर हेल्थ वर्कर के लिए, कि हमारे कोई डॉक्टर, नर्सेज या जो भी यहाँ के स्टाफ हैं अगर बीमार पड़ते हैं, सीरियस होते हैं तो हम लोग उसमें रखेंगे. और यहाँ कोई भी दिक्कत नहीं है अभी तक हमारे हिसाब से, है ना. कहीं कोई दिक्कत नहीं है। ऑक्सीजन सप्लाई वगैरह जो अभी टीवी पर चल रहा है, तो ऑक्सीजन सप्लाई वगैरह सब हमारे यहाँ एकदम है, कोई यहाँ प्रॉब्लम नहीं है हमारे यहाँ।
बहुत सारे स्टेट से ये खबर आ रही है कि ज़्यादातर जो पेशेंट हैं इस बार वो यंग पेशेंट्स हैं। बिहार में क्या है, किस एज ग्रुप के लोग हैं?
एक हाँ, यहाँ एक्चुअली सब तरह के हैं, लेकिन यंग लोग इस बार ज़्यादा हैं। दूसरी बात है कि बहुत से ऐसे लोग हैं जो कि सेकेंड कोरोना उनको हो चुका है, पहले भी 2 वैक्सीन भी ले चुके हैं, उसके बाद भी जो है तो फिर कोरोना हो गया है। तो इस तरह की हमारे डॉक्टर भी बहुत सारे हैं जिनको कि एक कोरोना पहले हो चुका था, 2 वैक्सीन भी उन्होंने लिया है और फिर अभी कोरोना हो गया है। तो हमारे अच्छे खासे डॉक्टर जो हैं हर डिपार्टमेंट के पॉजिटिव हो गए हैं। कुछ नर्स भी हो गई हैं, कुछ जीएनएम स्कूल की लड़की हैं वो भी पॉजिटिव हो गई हैं। तो संख्या काफ़ी बढ़ा है, इधर देख रहे हैं।
Dr. Mishra, anecdotal evidence coming from several states, as you heard from the medical superintendent of Patna also, is that younger population is now requiring hospitalization as it cannot be managed through isolation at home. They are developing big patches in their lungs too. What's making the young population so vulnerable in the second wave?
So one thing which we have noticed from various reports is that more and more young people are getting infected this time, which probably can be explained more because schools were opened and activities started, gym and sports and all. And these people were very confined and isolated for a long time, and they interacted, and so they essentially were more exposed to the infection, and that's why larger number of them got infection. There is no actual evidence, scientific evidence to suggest that virus is preferring more younger people. So far, there is no clear evidence for that. But what you are mentioning about the clinical symptoms which is a specific for the younger people, that's matter of concern.
Dr. Seth, our health infrastructure is overstretched. You heard from medical superintendent of PMCH in Patna. Crematoriums are feeling the pressure. Reports are coming from several parts. Even those who have got the vaccines are testing positive. What exactly is happening in the second wave?
So firstly, we must remember the fact that this is something which is unprecedented. The rate of rise is vicious, and it is truly overwhelming the healthcare system. Even today, I've had 20 phone calls of close friends, relatives, known patients who actually had COVID and want a bed in the hospital, and we haven't got a bed. And my colleagues would have got equal number of phone calls. So think of the fact that there are perhaps 100 and 150 patients on the waiting list to get into the hospital. The important thing at this time is that this has happened because there are a couple of things. There's the lack of COVID appropriate behavior. There's a callousness, there's a carelessness, but that's been all around. Let's not blame any specific group of public or others for it. It's happened all around. And when that's happened in the midst of an unlockdown, and the strain is a variant strains, and there are a number of variant strains, as you well recognize the fact that in Punjab, we actually have the British variants. There's the double mutant strain, which is multiplying more and more and actually taking more and more. Now 40% of the patients perhaps in Delhi may be due to that. There is certainly the other strains which are actually multiplying. We have a situation which I was saying about the young people. It's mainly because they're out and about. But the important thing to realize is that at this time, the reason for the pressure on healthcare infrastructure is due to the fact that on one hand, the numbers are rising exponentially. The deaths, by the way, this is a virulent strain, and that is why we're seeing at the moment that in a family where earlier 1 out of 4 or 2 out of 5 would actually have an infection, now the whole family has an infection because it's virulent. But it's at the moment we don't think that it is any more fatal than the previous ones, because all we're seeing is deaths due to only the increased volume and number of cases, and not necessarily due to the fact that it is more fatal.
Okay.
So absolute numbers of deaths are increasing. Now coming to the question about the vaccine, very importantly, we must realize that the vaccine after the first dose, 3 weeks after the first dose, offers a 50 to 55% protection. And even after the second dose, 2 weeks after the second dose, the protection is approximately 70%, which means that we still have a 30% chance of getting COVID infection. So the precautions have to continue. What is clear, and I would say that for the healthcare workers, my colleagues who actually had COVID after 2 doses of vaccination, you've heard doctors at other hospitals having had it, nurses having had it, is the fact that none of them have had serious COVID. None of them have been actually admitted to the hospital, and it prevents death. Those two are very important factors, a very important matrix. And that is the reason why we keep saying, continue to take vaccine, and continue precautions, because what we want to prevent is death and hospitalization.
Absolutely.
In a serious manner.
Yes,
those two are very important.
Sujata Rao, did we fail to learn really the lessons of the first wave? And that is the reason why the ramping up of capacity, which should have happened, because second wave is a reality. It had happened world over. It happened during the Spanish flu. And still, several states are found to be wanting as far as the health infrastructure is concerned.
Well, there are 2 points. One is that did we learn from the first phase? I'm afraid, as Dr. Seth has already pointed out, unfortunately, I think we as a people just got too fatigued with the lockdown, national lockdown, and the complete stalling of our life as we know it. And we did get into a complacency mode, and also the political environment added to it by having a whole range of diversionary programs like elections or what have you. So there was this complacency, and we did not prepare enough. A second was the complacency that came due to the comfort that we thought vaccines would give us complete protection. And so that added hugely to us feeling a sense of safety, though nobody ever said that a vaccine was a sure shot proof against getting corona. Having said that, you know, Marya, there is a limit to how much any country can prepare for.
Yes.
It's not possible. Of course, I mean, you know, in hindsight, I do wish that these epidemiologists who right from November, December were saying, we must expect a second wave that's going to be happening in March or so. And they did say it might even be more virulent, though I must say they never said it would be so horrific as it is today. But they did warn us, and we ought to have taken those warnings, because there is a limit to how much we can prepare. We can never be enough, you know, we can never be prepared enough, because it's these kind of figures are so stunning that, you know, I mean, they're projecting 3 lakhs a day.
Yes.
With wisdom, even United States, the best in the world, cannot take it.
Yes.
So, you know, I'm afraid that I have to say that in many health systems, they did do very well. They have taken a whole lot of hotels and ramped up the ventilators, access to oxygen and so on, but it has overwhelmed them.
Yes.
What worrying me, however, and I'd like to just say this as the last sentence, is the northern states, Bihar and UP. And knowing full well that Uttarakhand, Bihar, UP have very fragile health systems, it's not a question of a bed, but it's a question of personnel and manpower and access to abilities and capacities and skill base. It was very careless of us, I think, not to have enforced the prevention and enforce all this Kumbh Mela business should never have taken place.
Yes, certainly, ma'am. All these congregations only added to this spike that we are witnessing. We have 2 family relatives as well, Kaustubh and Ayush. Ayush, tell us your story first. Ayush.
हाँ जी मैडम, अभी क्या है ना कि हमारे एक रिलेटिव हैं श्री आयन पाठक जी, तो उनका एक तो बेटा पहले से कोरोना पॉजिटिव और वो ऑलरेडी पीएमसीएच में वो एडमिट थे, ये भी पॉजिटिव हुए, और इनका एक बेटा है जो कि टाटा कंपनी में काम करता है। तो अब ये बेचारे उनको 6 तारीख को यहाँ पे एक नर्सिंग होम है, प्रगति नर्सिंग होम, उसमें एडमिट करते हैं, और वहाँ पे उनको 12 तारीख को ये कह के निकाला जाता है कि इनको अब आप हायर हॉस्पिटल में ले जाइए, हम लोग नहीं रख सकते हैं। अब वो हर हायर हॉस्पिटल जो भी यहाँ पे है, यहाँ के जो सरकारी हॉस्पिटल से लेके जो प्राइवेट हॉस्पिटल बढ़िया, हर जगह बेचारे वो कहीं ना कहीं ट्राई कर रहे हैं कि कोई भी उनको एडमिट ले ले, लेकिन कोई एडमिट नहीं लिया। ये कंडीशन आ गया, रात के 12 बजे की एम्बुलेंस वाला ये कह दिया कि अब मैं इनको छोड़ रहा हूँ और आपको जहां इनको ले जाना है ले जाइए, अब हम इनको नहीं कैरी कर पाएंगे। लास्ट में वो अपने जीएम से कॉल करके फिर अपना जो टाटा मेमोरियल हॉस्पिटल है जमशेदपुर में बात करके फिर वहां पे उनको अभी एडमिट कराएं। तो फिर उनको वहां पे जाके फर्स्ट एड मिल पाया। तो और अभी अपने धनबाद से रोज का यही है हम लोग के पास, क्योंकि हम सोशल वर्क भी करते हैं, तो रोज यही एक हमारे पास मैसेज आ
इस
रहा है
तरह
कि
की
कहीं पे भी
स्टोरीज
अगर
आए,
सीट
राइट?
अवेलेबल है तो करवा दीजिए, क्योंकि
Kaushtup,
रात भर।
Kaushtup, tell us about yourself and your story.
Yeah, so sorry, my name is Pratyush, and I am the son of the
Yes.
deceased person. So Kostov is my
Okay.
cousin brother, and I lost my father, Mr. Sanjeev Sankheda, yesterday, and it
My
was all due to the
condolences.
mismanagement of the hospital, Kailash Hospital in Dehradun. So he was tested positive for COVID-19 on 23rd of March, and we had admitted him on 23rd, 31st of uh, 31st of March, and on 2nd of April he was admitted to ICU. The condition, the person that was overlooking the whole treatment was a physician, and when we told him is there's a chest specialist over in that hospital, so there's one chest specialist, Dr. Jagdish Rawat. So we were under the impression that he is the person who's overlooking them, and they said that the main person is Dr. Gopalji, who is a physician, but the test specialist is the person who is in constant touch, and he is part of the team. But later we found out that's not the case, and on 13th of April his condition deteriorated, and while he was in ICU, first of all, like, his condition was improving, and then his condition deteriorated. That is something that I cannot, uh, I do not know how it can happen. And also, I used to visit my father almost on a daily basis for around 20 minutes, and there I found the sanitization scenario was also not that good. And and after that, and that point of time, they were, what I found was that they were actually more interested in making money than treating the patient properly.
We
And
seem
what
to have
happened
lost that
eventually?
connection. Yes, there,
Hello.
yes, there's a problem with that connection. Doctor, say a quick word from you. 30
Yes,
seconds to you.
my sympathies with the son, and my sympathies and condolences. But we must remember that the healthcare workers and the doctors are working 24 hours a day against this vicious pandemic, which the world has never seen before. If you see the doctors working, the nurses working, every technician working 24 hours a day in PPEs, and this acts, the weather is going to get warmer and warmer, and people sweat in that. Wear a PPE for 24 hours, and you realize how much is being done. And these are the people who are actually risking their lives, risking their families, of looking after the
Absolutely.
COVID patient. We must remember that even when we intubate a COVID patient, we actually release so many droplets that I've had friends, I've had colleagues who actually passed away with COVID. Last year, 800 doctors passed away.
Yes.
Luckily, the doctors are vaccinated this time. But I could also tell you that two of my friends, my classmates, actually passed away in my hospital in similar circumstances from COVID, just like this person has described, and I couldn't save them. And they were my classmates. So this is a vicious disease, and it's known
Yes.
that people get better, and by 10th to 12th day, the 13th day, the
Yes.
cytokine storm comes in, and that's very difficult to prevent. And by the way, we should also know the fact that there are no cures available for COVID.
That exactly,
There's
Doctor said there is that
every drug, there
uncertainty
is no
around it.
proven drug.
And let me give the final
Absolutely.
words to Dr.
And
Mishra.
that is why we say
Yes.
prevent, prevent, prevent.
Dr. Mishra, based on data and experience of other countries with over 2 lakh cases and 1100 deaths in the last 24 hours, what's your assessment of the next few weeks?
Is really really grim and very serious, because there is no reason to imagine that the crisis will pause or even plateau very quickly, unless we do something drastic. And drastic of that, I don't think even government is even considering the idea of total lockdown, because that leads to much bigger problem than the COVID in some aspects. But I think we are not at all responding to the need, which means reducing the crowd. We just simply know how the disease goes, how how disease spreads. It spreads from one person to other person.
All right, Dr. Mishra, thank you so much for joining us, and a thanks to all the guests who joined us and shared their stories and experiences. It is a grim situation out there, so be careful, wear the mask. That is the only way to protect yourself and your family. That's all from me. Thanks so much for watching.